future nurses who are watching this video. Hi, my name is AVRIL, and I'm a third-year nursing student, and I'm here to help you learn nursing topics made fun and easy. Welcome to Genius Hour, and the topic for today's video is all about pleural effusion. Let's get started! Pleural means pertaining to the pleural, which is a serous membrane that lines the lungs and the thoracic cavity. Effusions will happen when there's an abnormal collection of fluid inside the cavity in the body. Pleural effusion is a collection of fluid in the pleural space that causes pain and shortness of breath. The visceral pleural lines the lungs. The parietal pleural lines the thoracic cavity. The pleural space is located between these two linings and contains a pleural fluid. It serves as a lubricant of the lungs and the thorax. It allows the lungs to move freely and smoothly when we are breathing. Normally, the pleural fluid is only about 5 to 15 ml, but anything more than that is considered excessive, and of course, when the pleural effusion is present. Pleural effusion is rarely the primary disease, but is secondary to other diseases such as a complication of heart failure, TB, pneumonia, pulmonary infection, especially in viral infections, nephrotic syndrome, connective tissue disease, pulmonary embolism, and neoplastic tumors. Bronchogenic carcinoma is the most prevalent malignancy linked to pleural effusion. During a pleural effusion, fluid can build up in the pleural space to the point that it becomes clinically noticeable. This pleural fluid can be categorized or classified based on the modified Lights criterion, whether it's a transudate or an exudate. If at least one of these conditions are met, the fluid is considered as an exudative effusion. First, pleural fluid protein serum protein ratio is more than 0.5. Second, pleural fluid lactate dehydrogenase or LDH serum LDH ratio is more than 0.6. Third, pleural fluid LDH is more than 2/3 of the upper limits of normal laboratory value serum of LDH. Pleural fluid can be classified into transudates and exudates. Transudates are commonly clear and caused by conditions that alter the hydrostatic and oncotic pressure in the pleural space. These include congestive heart failure, nephrotic syndromes, liver cirrhosis, hypovolemia that leads to malnutrition, initiation of peritoneal dialysis. And exudates are commonly cloudy and caused by pulmonary infections such as pneumonia, tuberculosis, or malignancy, or inflammatory disorders such as pancreatitis, lupus, rheumatoid arthritis, post-cardiac injury syndrome, chylothorax due to lymphatic obstruction, or hemothorax or blood in the pleural space, and benign asbestos pleural effusion. Clinical manifestations of pleural effusion are commonly caused by the underlying illness. For example, in cases of pneumonia, the patient can experience fever, chills, or pleuritic chest pain. But in a patient with malignancy, the patient can experience dyspnea, difficulty in lying flat, or coughing. The size of the effusions and the speed it forms and the underlying lung illness all influence the severity of the symptoms. Dyspnea or shortness of breath can be caused by a large pleural effusion. A pleural effusion that is small or to moderate can cause little or no dyspnea. Assessment and diagnostic procedures. In the assessment of the area with pleural effusion, it may reveal a decrease or absence of breath sound, decreased fremitus, and a dull flat sound on percussion may also be heard. Acute respiratory distress and extremely large pleural effusions can happen. Tracheal deviation away from the affected side can also happen to the patient in these cases, such as the one in this X-ray radiograph. Diagnostic procedures for pleural effusion include physical assessment, chest CT, chest X-ray, and thoracentesis. In this picture, we can see a lateral decubitus X-ray, and it can be taken in some cases. A patient is in a side-lying position on the affected side for this X-ray, because this position allows for the layering out of the fluid and the visibility of the air fluid line. Pleural fluid can be analyzed through a bacterial culture, Gram stain, AFP stain for tuberculosis, red and white blood cell counts. Chemistry studies for glucose, amylase, lactate dehydrogenase, and protein may also be done. Cytological analysis for malignant cells, pH, and a pleural biopsy may also be used and performed as a diagnostic tool. Medical management for pleural effusion has three main objectives. First is to determine the underlying cause. Second, prevent the accumulation of fluid. Third, relieve discomfort, dyspnea, and respiratory compromise. The underlying cause is treated specifically. For example, the patient has a heart failure or pneumonia or cirrhosis, and specific care will be given to treat these conditions. If pleural effusion is an exudate, it will be further examined by the analysis we have tackled earlier, and once determined, the primary cause is treated. Medical management for patients with pleural effusion may include thoracentesis. It is a procedure that involves aspiration of fluid and air from the pleural space. It is also done to remove fluid, to obtain a specimen for analysis, and to relieve dyspnea and respiratory compromise. Thoracentesis can be done with the help of an ultrasound. The patient may be treated by draining the fluid during a thoracentesis procedure or by placing a chest tube to a water-sealed drainage system or suction to empty the pleural space and re-expand the lung, depending on the amount of the pleural effusion. If the underlying cause is malignancy, the effusion will most likely return with just a few days or weeks. Pain, protein and electrolyte depletion, and pneumothorax can all happen due to repeated thoracentesis. An option they can have here is pleurodesis, which involves completely obliterating the pleural space to prevent fluid reaccumulation. Chemical pleurodesis is a therapeutic treatment that involves administering different chemical agents into the pleura to form a symphysis between the parietal and visceral pleura. It can be talc, tetracycline, or iodophobidone, and others. Other treatment options for pleural effusions caused by malignancy include surgical parectomy, which is a surgical removal of the pleura which is affected. Another is the insertion of a tiny catheter attached to a drainage bottle for outpatient care, and implantation of pleural peritoneal shunt. Nursing management. Our role as nurses in caring for patients with pleural effusion involves supporting the medical management. The nurse must prepare and position the patient for thoracentesis as well as providing support during the procedure. We must also ensure that the amount of thoracentesis fluid is recorded and forwarded to the proper laboratory for testing. If a chest tube drainage and water seal system is used, the nurse must monitor the system's function and record the amount of drainage at prescribed intervals. And we must provide a specific nursing care based on the underlying cause of the pleural effusion or condition. Pain control is a top focus when a chest tube is inserted for talc instillation, and the nurse must assist the patient in assuming the least painful positions. It is critical to move about and turn frequently to ensure that the talc is evenly distributed across the pleural space. The nurse must assess the level of the patient's pain and give prescribed analgesics as needed. If the patient is being treated as an outpatient with a pleural catheter for drainage, the nurse must educate the patient and the family how to manage and care for the pleural catheter and the drainage system. For a quick summary, pleural effusion is a collection of fluid in the pleural space that causes pain and shortness of breath. Pleural fluid during a pleural effusion can be classified into transudates and exudates. Clinical manifestations of pleural effusion are commonly caused by the underlying illness. A large pleural effusion can cause dyspnea, while a small to moderate size can cause little to no dyspnea. Assessment findings involves decreased or absent breath sounds, decreased fremitus, dull flat sound on percussion. Diagnostic procedures can be physical examination, chest X-ray, chest CT, and thoracentesis. Medical management of pleural effusion aims to determine the underlying cause, prevent accumulation of fluid, and relieve discomfort, dyspnea, and respiratory compromise. Nursing management of pleural effusion involves supporting the medical regimen. Here are my references, and you can take a screenshot if you like for further reading and information. I prepared a quick self-test in the next slides. You can pause the video as you answer it, and you can also scan the QR code or go to the link for the Google correctly? Awesome! Tell me your scores, thoughts, and suggestions in the comment section below. I hope you learned something from me, and future nurses fighting! Thank you so much for watching, and please like and share this video. See you next time! Bye bye!